Somewhere is there.
Well, 15 total, so 10%. Not yet.
Okay, everybody, I think we're about ready to get started. I'm going to call this Emergency and Community Services Committee meeting to order, our final Emergency and Community Services Committee meeting of this term of council. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also be audibly and/or visually recording this meeting. Changes to the agenda, Madam Clerk.
Yes, Mr. Chair. Robert Fife, Chair of the Hamilton Veterans Committee, is not able to attend today's meeting to make the presentation listed as item 7.1 on the agenda. Therefore, item 7.1 will be presented to committee at a later date. Also, Tom Cooper, who has a delegation in item 6.1, has requested to be allowed to speak for 15 minutes rather than the 5 minutes.
Okay, we had a motion to approve the agenda as amended. We have no declarations of interest and a motion to approve the minutes of the September 8th, 2014 meeting, moved by Councillor Partridge and seconded by Councillor Whitehead. All in favor? That's carried. Members of the committee, we heard about a delegation request, 4.1, 4.2 before us, wishing to address committee today respecting item 7.2 on the agenda. If they are approved, they will be heard after the staff presentation in item 7.2. So can I get a motion to approve the delegation request? Moved by Councillor Jackson, seconded by Councillor Marula. All in favor? That is carried. Any opposed? Seeing none. Members of the committee, you have consent items 5.1 through 5.4 now before you. Looking for a motion to receive 5.1 and 5.2. Moved by Councillor Jackson and seconded by Councillor Morrow. All in favor? Any opposed? Seeing none. And we're looking to approve 5.3 and 5.4. Moved by Councillor McCaddy, seconded by Councillor Barula. Thank you. All in favor? Carried. Any opposed? Seeing none. On to public hearings. I now call upon Mr. Cooper of the Hamilton Roundtable for Poverty Reduction for his delegation. It was requested that he get an extension of 10 minutes. Anybody wish to move an extra 10 for Tom? Moved by Councillor Marula and seconded by Councillor Morrow. All in favor? Carried. Any opposed to 15 minutes as opposed to 5? None opposed. You carry some weight. Hello, Tom, and thank you for coming.
Is that it? There we go. Howard Elliott, Chair of the Hamilton Roundtable for Poverty Reduction, to come up and address you first.
Thank you. And thank you, members of the committee, Mr. Chair. Thanks for having us here today to bring you some updated information about the HRPR, some of the work that we're doing. And I'll be fairly brisk about this because I want the important folks to have more time of the generously allotted 15 than me, but I do want to pass along a few things too. You may or may not have heard that the roundtable is going through what amounts to an administrative change and a change of location. First, the change of location, effective about a week ago or so, the roundtable took up residence in an office at the Hamilton Community Legal Clinic from its previous location at the Hamilton Community Foundation. This administrative change leads up to what's going to be a change in what we call the fiscal sponsorship of the roundtable, which simply means the administrative and sort of flow-through backshop mechanisms which previously resided at Hamilton Community Foundation, sometime in the not-too-distant future will move over to the Community Legal Clinic. And I'd like to explain that, why that's happening to you, because we don't want there to be any misunderstanding. This is not in any way, shape, or form a backing away from or withdrawal of support from the Community Foundation. It was never envisioned that the roundtable would live at the Community Foundation in perpetuity. In fact, as long ago as several years, when Carolyn Milne was still at the foundation, we had started discussions about what the next step might look like. And we came to a successful resolution after a lot of effort and partnered with the Hamilton Community Community Legal Clinic, which we're very happy about. The foundation continues to be a solid financial sponsor and active on the steering committee of the roundtable. The only thing that's different is that we're in a different location now, and eventually our fiscal sponsorship will move from the foundation to the Hamilton Community Legal Clinic. That would be a project of that clinic. So that's about it for me. I want to say thank you once again, and I want to say a special thank you to Joanne Pryle, whose leadership and help with the roundtable remains as invaluable today as it was when she helped get it started 7 or 8 years ago. So Joanne, thank you. We count on you. Thank you very much. And I'll hand it off to Tom.
Thank you, Howard. Thank you, through you, Mr. Chair. I'd like to provide a little bit of an update on the work of the Hamilton Roundtable for Poverty Reduction. As we head into a bit of a transition, as Howard mentioned, for ourselves administratively, the Hamilton Roundtable has continued to try to utilize its resources within the community to identify and respond to the issues of poverty in this community. Just as a bit of a refresher, our commitment to the community is to stand together to find the solutions to poverty that will truly bring prosperity to Hamilton. We come together to act comprehensively and systematically to tackle the root causes of poverty. We wanted to create a new role for discussion in the community when the Roundtable was established back in 2005 through the leadership of this council. And some of you may recall it was a report from the Social Planning and Research Council back in that year that determined that there were up to 96,000 individuals in Hamilton who are experiencing poverty. Perhaps most concerning were the 1/4 of all of Hamilton's kids who are growing up in low-income households. And to that, Joanne Pryle and Carolyn Milne stepped forth, created a new table for the first time in this community to really look at addressing poverty differently. We knew there were a great many organizations and agencies in Hamilton that were doing a fabulous job responding to the crises that individuals face every single day in this community. The challenge, though, was being able to delve a little bit deeper and really look at the policy decisions that reflected why those individuals and families were living in poverty. And so Carolyn and Joanne brought together a group of leaders in the community that evolved to include individuals with the lived experience of poverty. And today, the Hamilton Roundtable for Poverty Reduction is an 80-member body. And half of those members are individuals who experience poverty every day. And their contribution to our work, I think, is absolutely invaluable. It's their vision and their drive to see change that has really inspired all of us to ensure that we can continue to be a strong voice for those experiencing poverty in Hamilton. So I wanted to update a little bit about what we've been working on over the last year or so and take a look forward. Because there has been some changes on the provincial level to how the Ontario government is going to be responding to poverty across the province. And I think there are some very interesting opportunities for us as a community. There also continues to be grave challenges for individuals, and particularly individuals who are living in the deepest poverty in society, those on social assistance. First, though, let me talk a little bit about our goals. It's to change community attitudes about poverty, address income disparity, include all citizens in community life, and promote innovative ways to tackle concentrated poverty. We have a number of work groups, and we'll talk a little bit about each one of those over the next couple of minutes. But our Shifting Attitudes working group has really been an exciting group of people who've brought together new thinking on how we can change attitudes in the community about poverty reduction. And that's gone from ensuring that the voices of those with the lived experience of poverty are heard in a little bit of a different way, to really looking at how we can shift generational thinking about poverty. One of the ways we're doing that is through working with the Public Health Department and both boards of education, the Hamilton Wentworth District School Board and the Hamilton Wentworth Catholic District School Board, to develop a new resource in high schools that looks at income disparity in communities. Just last week, through the leadership of Joanne Salce, who is with Public Health Services, a group of teachers came together to look at developing a new resource that can be taught in the classroom on income disparity. It's already been piloted for the last year, and it's really an opportunity to get students and their teachers in a new dialogue about poverty in the community. And this resource is really, I think, going to be instrumental in changing attitudes, but also shifting the way people think and students think about poverty. It's building empathy. It's, more importantly, though, building understanding about the root causes of poverty. One of the other exciting things we've been doing over the last year or so is developing a speakers bureau of people with the lived experience of poverty. It's been a goal we've been looking at doing for the last couple of years, and we were able and fortunate, I think, to be able to bring on board Celeste Licorice as our coordinator for a new project called Speak Now. And I'm going to ask Celeste to talk for a couple of minutes about the development of the Speak Now Speakers Bureau, who's involved, and what we hope to accomplish through it. Celeste?
Thank you, Tom. Thank you, councillors, for having us here today. So as Tom mentioned, my name is Celeste Licorice, and I am the coordinator of Speak Now Hamilton, Stories That Matter. It's a project that the Roundtable, in their wisdom, decided that it would be important to have people with a lived experience of poverty learn how to share our stories with audiences. One of the things that we have noticed is that people get real misconceptions about what it means to live in poverty. But if you talk to people, if you get people who actually live day-to-day struggling and get them to share their stories, you develop the things that Tom were talking about, the empathy, the understanding, to be able to change attitudes and shift attitudes and change the way people think and the way people act and vote. I had the privilege of working with 28 people. We went through a search process throughout the city to find people who wanted to share their stories, people who were living in poverty, but who had the courage to learn public speaking, which is no easy task. We were able to find over 60 people who applied. Of those, 28 participated in training, and 21 graduated in April after a 12-week training session in learning the art of public speaking, storytelling, and finding their own stories and being able to craft them into something that they could share with audiences. Since graduation in April, our speakers have spoken at maybe 45 to 50 different events and spoken to audiences as large as 1,000 and as small as 8. Wherever there's a group that wants to hear about what it means to live in poverty in the city, we have 21 people who are trained, ready, and able to go out and share their story. They range in age from 23 to mid-70s. Some of them have been in poverty their own whole lives, generationally. Others have earned 6 figures and because of life circumstances have found themselves in poverty. We all share the desire for that to change, and they've all found the courage and the strength to be able to share their stories publicly. So with that, moving forward, I would like to tell everyone that we are available to speak and that we are willing, whenever you need to have an audience or to hear anything about poverty from the people who live it, that Speak Now is here to share.
One of the other priorities you'll recall we've been working on over the last couple of years is to make Hamilton a living wage community. And as we're keenly aware, there are too many individuals, well, 30,000 by last count, who go to work every single day in this city and are not earning enough to pull themselves or their families out of poverty. They're the working poor. Together with our community partners, we've committed to try to work on building a living wage community for Hamilton. And we've been tremendously successful over the last couple of years in changing, I think, perceptions about living wage and really ensuring that it can become part of the community dialogue. Just in the last year, we've developed a new declaration for employers in the community to sign on to if they feel comfortable and they're committed to becoming a living wage employer. And at last count, we now have 12 organizations in the city from all sectors, from the private sector, from the nonprofit sector, from the public sector. You'll recall that the Hamilton Wentworth District School Board became the first public sector employer, not only here in Hamilton, but in Ontario, to declare themselves a living wage employer. And they became the first elected body to do so, as the trustees voted for that. The commitment has also been forwarded through McMaster University. And a couple of weeks ago, McMaster committed to ensure that their cleaning staff would be paid a living wage as well. And while conversations are ongoing with other private sector businesses in the community, we're very pleased to see a number of faith groups step up, local churches. We are very happy that a number of nonprofit organizations are also doing so, and we have a meeting tomorrow hosted at the invitation of Bishop Crosby to speak with 20 Catholic service agencies in the community to talk about living wage, and we're hopeful that some of those organizations will also commit and become a living wage employer in the community. We really do see living wage as a benefit not only to those individuals who are experiencing poverty but working, because if we believe in the Canadian dream that if you work hard, you work your hours, you should be able to move yourself and your family out of poverty. Unfortunately, too many individuals cannot do that under circumstances right now. The minimum wage simply does not come close to meeting the actual cost of living in the community, and why we've calculated an evidence-based living wage, which is now calculated at $14.95 an hour. We also know that living wage is good for employers as well. When living wages are paid, employers, from the results we've seen in 150 jurisdictions where it's been implemented in the United States, in the United Kingdom, and in some places in Canada, employers see a significant increase in productivity. They see a reduction in sick time. They see a reduction in absenteeism, and their training costs are lower. So in a very real sense, living wages are good for those employers, and it's good for the community as well, because when people are earning more, that's money that's being spent in the community on local goods and services, money that's being distributed in the community and driving economic growth. Hamilton has been recognized, I think, particularly in Eastern Canada for its leadership on living wage, and we've been very, very pleased to work with Mark Weingartner and through the committee that Paul Johnson is chairing on looking at ways that the municipality of Hamilton can learn about living wage and really, I think, when at the point it feels it is able to sign on and hopefully become Canada's first big city living wage employer not too far down the road. I'm just showing a little map here of the burgeoning influences of living wage in Canada. More than 30 communities are now calculating a living wage, and we really do see this as an international movement. I was asked to go speak in Glasgow in June at a conference, and had the opportunity to talk to our counterparts in Hamilton, Scotland, about living wage. They have taken a leadership role in Hamilton, just as this council has done on many, many issues, and Hamilton became a living wage local authority. And so I'm hoping we at some point will be able to follow that as well. The last thing I'd like to chat with you about today, with your indulgence, is the commitment from our provincial government to move forward on poverty reduction. And we were very pleased during the last provincial election in May and June to really engage the community around the need for a poverty-free Ontario. And we had more than 500 lawn signs distributed across the community. This council, I think over the last term, has been absolutely clear and instrumental in ensuring that issues of poverty are first and foremost. It was this council, and I think one of the proudest moments I've had in my job was when this council committed to ensure that in the 2012 provincial austerity budget, when critical services for individuals on social assistance who are trying to find housing were cut, this council stepped up, provided $3.5 million for community startup benefit, provided another $3.5 million for extended health benefits for those who are the most vulnerable in society. The provincial government did listen after a community and wide-ranging consultation here at City Hall with 12 other communities from across the province. The provincial government stepped up and provided $42 million in interim funding, and in the last provincial budget ensured that would remain stable, $42 million to ensure that there was housing assistance for those families who needed it. So we're very glad they recognized it was a mistake to cut those programs originally, but that was really just coming back to a place where we were. We know there are far too many individuals living in deep poverty, and a vast majority of those who are living in the deepest poverty are on social assistance in Ontario. So I want to talk a little bit about that. The Ontario Poverty Reduction Strategy Phase 2 was just released a few weeks ago. I had the opportunity to travel to Toronto to meet with Minister Matthews briefly and talk with her about the strategy shortly after it was released. The provincial government is committing to continue its quest to reduce child poverty by 25%. They had committed to do that in the first 5 years of the Ontario Poverty Plan from 2008 to 2013. They only got about half of the way there. I think an important aspiration they've identified is ensuring that homelessness is eliminated in Ontario, and they are the second government in Canada to commit to do that. The provincial government in the last budget and reinforced in the Ontario Poverty Strategy has also committed to provide communities with $50 million over a 5-year period to ensure that there are sufficient resources in communities to tackle poverty. So we'll be looking with interest at how that can be allocated in communities. But there are serious questions with the Ontario Poverty Strategy. There was very little emphasis on precarious employment, and we know from the outstanding research that's been done at McMaster University through the Labour Studies Department and through Dr. Wayne Luchuk that precarious employment is a very serious concern in this community. You may have heard that EI benefits are almost unable to be accessed by the vast majority of people who are unemployed. Only 21% of current people in Hamilton who are unemployed qualify for unemployment insurance benefits. We think there really needs to be a stronger commitment by the provincial government to look at precarious employment, and I'm very, very pleased that this city has stepped up to help in a very modest but very real way those individuals who work but are having a very difficult time trying to eke out a meager existence. And that's through the Affordable Transit Pass. And I think I saw Erica here who's been working diligently on that program, but it's really an important program to ensure that people who are working can get a half-price transit pass to assist them in getting to their place of work and ensuring that those jobs are available to them. In my last couple of minutes, I just want to talk a little bit about social assistance, because as we've talked about numerous times in this chamber, those individuals, close to 50,000 of them in Hamilton today, rely on provincial social assistance as their main source of income. These are individuals on Ontario Works or the Ontario Disability Support Program, and as we've indicated, they are living in the deepest works, and if you factor in the cost of even the cheapest bachelor apartment in Hamilton on top of what public health would indicate is necessary for nutritious food, on top of clothing, on top of hygiene products, on top of a telephone so a potential employer could potentially call them back, individuals on social assistance are falling hundreds of dollars behind every single month. And that's why in this city alone, we see that 75% of those going to food banks are on provincial social assistance programs. It is a very real source of downloading, I think. And in a very real sense, the provincial government is legislating hunger, legislating ill health through its inability to fix the social assistance system. So we would continue to encourage this council to speak out strongly, as it has over the years, to demand that the provincial government take a further look at social assistance and really begin to reform the system. Rates have been woefully inadequate for the last 20 years, and as you can see from this chart, in real terms, social assistance rates are actually lower today than when this government came into power, if the cost of living is factored in. So it's a very real concern, and people in Hamilton and individuals on social assistance across the province continue to suffer, and it is a situation, unfortunately, that has not been resolved or committed to change in this current Ontario poverty strategy. So we're going to continue to push that forward. We're going to continue to push for benefits, extended health benefits for all low-income members of the community. And with your continued assistance and support, we know the provincial government will begin to listen. So thank you very much, Mr. Chair. Appreciate the extension in time, and certainly we'd be willing to answer any questions. Just before I wrap up, though, I'd just like to thank Jennifer Chivers, who is the other member of our team, along with Celeste, for her outstanding work over the years. Thank you, Jennifer, for all you do for us. So thank you very much.
Thank you, Tom. We do have a few questions. Brian, Councillor McCaddy, Councillor Whitehead, Councillor Marula, and Councillor Morrow. Councillor McCaddy?
Thanks, Mr. Chair, and thanks, Tom, as always, for the update, comprehensive and inspiring for us to do even more than we have. So we'll certainly pick up that torch. Early on in your presentation, you spoke about 8 years ago when we began this journey with the Poverty Roundtable, 96,000 Hamiltonians living below the poverty line, 25% of children in that circumstance. I know the federal government threw us a curveball with the way they collect stats and that sort of thing, which is problematic. But do we have any sense of 8 years later how we're doing on those numbers?
The sense, Councillor, through you, Mr. Chair, is that the situation has improved somewhat. And that's a qualification. As you indicated, the most recent census data, the National Household Survey, is not, I believe, entirely accurate. They have indicated that at present there are 79,000 low-income individuals living in Hamilton. In comparison to other cities, Hamilton's incidences of low-income households has dropped in comparison to other like communities. Back in 2001, when we started when we used the census data to track the Roundtable's progress, Hamilton was tied pretty much with Toronto for the highest poverty rate in the province. We're now, again, not entirely accurate because of the different way of calculating the numbers, but Hamilton was dropped significantly in terms of its poverty rate in relation to other communities across the province. So Windsor, London, Welland, a number of other communities, Brampton, are higher than Hamilton now, unfortunately.
Sure, I think that's important to note, all this effort that the Poverty Roundtable is engaged in, and everything this City Council has done over the last 10 years, 8 years during the Poverty Roundtable's time has made a difference. We know that a lot of the levers that you've talked about here, Tom, the income issues in particular, the social assistance rates, that's provincial initiative, the EI issues, federal, housing issues, which are shared by both those higher levels of government. That's where the real gains can be made if they ever take responsibility for those which they haven't done, and we need to force them to do that. So that's still good to note the gains that we've made. Just a quick question: when you when you spoke to Deb Matthews of the province, is there any sense at all that they're going to move on social assistance rates?
They've committed to move forward with implementing some recommendations from the Social Assistance Reform Commission that was launched a couple of years ago. There are more than 100 recommendations in that report, though, so which recommendations they decide to move forward on, we're not quite sure. I have invited Minister Matthews to come to Hamilton at some point within the next month. I've indicated our roundtable would be very interested in meeting with her to ask those very questions, and if appropriate, I'm sure she'd be willing to meet with council as well.
Right. Great. Well, thanks very much, Tom, Howard, and everyone in the roundtable for the work. Great to work with the speakers as well, Celeste, as well.
Thank you.
Councillor Whitehead.
Tomorrow has to leave, and he's on the list. I'll let him go defer my position.
Councillor Morrow?
And I'll go after.
Thank you.
Have to go somewhere else and then come back. I don't want you losing your quorum, but I'm very impressed with Tom, as always, and the other presenters here. And I've tried to follow over the years the work of the Roundtable, and Mr. Chamberlain before, now Mr. Elliott, and of course Tom, I've known since he was a little kid, so it's always great to see him. And I'm glad that I don't speak from any position of expertise, but I'm glad to see the emphasis on income. I think that counts for so much. It occurred to me that with all the wonderful programs that we weren't actually talking income enough. And particularly our friends in the United States have such a movement against income redistribution, which I'm glad hasn't developed quite the same way here, but that's what it's all about. It's helping others. So I'm glad to see this label. I hope we can respond accordingly at our relatively junior level, but encourage others to fix things up. And I'm very supportive of what's being presented today. Thanks.
Councillor.
Thank you, Councillor. Councillor Whitehead.
Thank you, Mr. Chair. I have really appreciate the presentation and all the work of the roundtable and all those stakeholders that have been involved in the process. It's a daunting task. It's been here, eradicate poverty. It's just a couple of questions. First of all, the first one I had is EI. I mean, I'm not clear on what changed on the geographic rulings of EI. But again, as a council, I'm not sure if we've taken a position in how Hamiltonians are being treated as with these new rules in EI, because we haven't taken a position. Can you just help me understand what changed and the challenge that people have on EI in Hamilton?
Through you, Mr. Chair. The biggest challenge for individuals in today's workforce, I think, is the realization that a stable, full-time job simply isn't realistic for a great many workers in today's economy. And what we see more and more of are individuals working several part-time jobs on contract. And unfortunately, the way the federal government has structured the new EI rules pretty much precludes a vast majority of individuals in that situation from getting enough hours to qualify for employment insurance benefits. So if you work a contract position, a great many individuals work several part-time jobs, but simply aren't getting the hours needed to qualify for EI. And there's a huge EI surplus at the federal level. They utilized $60 billion a few years ago towards the deficit, but it's building up again, and it really is, I think, punishing individuals because of the fact that while they may be out looking for work and trying their very best to get work, there simply aren't those full-time permanent jobs available for them to be able to acquire the hours needed to qualify for EI.
So one of the challenges I'm going to put out to the roundtable then is to come up with a Made in Hamilton solution for this council to consider relative to those challenges on EI, because I think you're the experts, you understand the impacts and the implications. I think we as a council are prepared to carry the ball, and through Federation of Canadian Municipalities, AMO, and all the different associations and organizations that we have to push that issue, but you are the experts in regards to the real impacts, so you need to bring that information back. So that's a challenge to put to the round table, and look forward to it.
Absolutely, Councillor. And I would emphasize again the importance of programs such as the Affordable Transit Pass for individuals who fall into that situation, ensuring that there's adequate childcare spaces and accessible childcare spaces available for single parents who may need, who desperately need that assistance if they're trying to stay in the workforce.
That livable wage. There's always been this challenge with livable wage, and that, I mean, in my opinion, it should be the federal and provincial government just coming down and saying this is it. Difficult in a municipal sector because you're in a situation where you're creating unfair loads to some organizations that may be competing, and then their next door neighbor doesn't abide by it, and they're paying lesser costs, and it creates this inequity. What is the response, I mean, from both the feds and the province to date on livable wage?
Well, the provincial government has certainly increased minimum wage above where it was previously. Unfortunately, even at $11 an hour, looking at the cost of living, it's still leaving workers 16% below the poverty line, according to the Workers' Action Centre. I think that's where there's a real opportunity for municipalities to step up and show leadership. And as I showed on that map, there are 30 communities across the country that are starting living wage initiatives. And it really is a way of showing prospective employers, I think, but also existing employers that it's important to have employees who are earning enough to move themselves out of poverty. It will ensure better health. I think it's a better community outlook for those communities. There are, at present, there's only one municipality in Canada, and that's New Westminster in British Columbia, that has officially adopted a living wage policy. But there are many that are bringing those recommendations forward to their council. And again, I think it is a win-win-win. It's good for the employee, it's good for the business, and it's good for the community, because again, it drives economic growth. It ensures that those people who are previously existing in poverty and going deep in debt will have a little bit more disposable income, and that's good for community economic growth.
And I appreciate that. I certainly espouse those values that economically you put more money in livable wage into those people's pockets. They're spending those dollars in the local economy, and it certainly has a ripple effect as opposed to the 80-20, where 20% of the population controls 80% of the income of the dollars, and clearly that's a disparity that still needs to be addressed. You don't speak much about that, but I am, because I guess my concern is that often we look for solutions. Those solutions are impacting more the people in between, not part of that 20% that control the amount of dollars in Ontario. So you're impacting other people that may be similarly having financial challenge. It could be the difference of doing well and not doing well. So the question is, how progressive is our taxation system to address the poverty issue? And I think that's another discussion that needs to take place.
Yeah. I will just quickly point out that Ontario in Canada has one of the lowest corporate tax rates in the entire world. Out of all 180 economies in the world, Canada's in the bottom 10 in terms of rate of taxation, ease of paying taxation. So I think there is opportunity to develop a more equitable system, and ensuring that we can start to build that more just society again, I think is absolutely critical to respond to the economic plight that many individuals find themselves in.
Appreciate that. And my last question, again, is similar. If we were to eradicate poverty in the city of Hamilton, understanding a lot of the challenges and the costs of those challenges you've identified, have you ever looked at what that would mean per household? And I'm not suggesting that we'd be raising taxes to accommodate that, but it provides a context and a dialogue. And obviously the province steps in and the federal government steps in as they should, but it provides a context of what it would take to eradicate poverty in Hamilton. Have we done any work on what that cost might be?
We haven't done it specifically at our table, but there have been other groups that have, and the Ontario Association of Food Banks has indicated that poverty in Ontario costs each individual about $2,200 a year, and that's responding to the impact of poverty. So in terms of the healthcare system, in terms of lost opportunity and education costs, and in terms of those direct social service costs, and we know that's pretty much equivalent to what the average property taxpayer may pay, or just a little bit less than that. So it's a huge impact on poverty, and if we were to provide individuals with an adequate income, if we had the housing supports available to families who needed them, if there were childcare spaces, if we paid a living wage to those who are able to work, we would see a significant investment as a result, and we would see a reduction of those costs.
I appreciate that. I think I'm curious overall what to eliminate poverty in Hamilton and in Ontario, what we predict the net cost would be, and now we got something to build towards. And so it'd be nice if we can sort of understand what that number is. Thank you.
Thank you.
Thank you. Councillor Marula.
Thank you, Mr. Chairman, and welcome, Tom, and many thanks to all that's presented here today. The one thing I want to really emphasize, because sometimes we look just beyond our toes and we forget really what the foundation of the problem is. And I appreciate that the city is taking the lead on a number of these issues, but we have to look at this issue from a global perspective. We have a federal government that in February announced a $1.1 billion surplus. And we have a province that went through measures impacting, victimizing some of the poorest in this province, by extension the city. It's then trickling down to the city, where nearly 40% of our budget has absolutely nothing to do with this city council and everything to do with the province of Ontario. When you break down and crunch the numbers, we collect 2% of the taxes, but yet we get 98% of the focus and attention. And we allow the feds in the province to walk away with the vault as we get scrutinized for tuna sandwiches. So could you just elaborate from a national perspective, what is the status of a federal poverty strategy, a federal housing strategy, a federal homelessness strategy, and a federal living wage strategy? Through you, Mr. Chairman.
Mr. Chairman, through you, non-existent, not there, don't know. Unfortunately, the federal government is not at the table when it comes to many of these issues. While the federal government has, I think, worked with communities individually on some specific projects, Canada remains one of the only countries in the industrialized world that does not have any of those things: a national poverty strategy, a national child care strategy, national housing strategy, and a national hunger strategy. And really, although Canada has become one of the most decentralized governments in the world, and provincial governments have stepped up, I think, in many cases, and now we have 8 out of 10 provinces that have adopted provincial poverty strategies, I strongly believe there is a need for a federal presence to respond to these national crises, and they are national crises. There are as many as 200,000 individuals who are homeless on any given night in this country. If you compare that to other jurisdictions around the world, take Sweden, for example, at last count, their homeless population was 286, I believe. Canada's homelessness rate is 1,000 times greater. And there's no reason for that, apart from the policy decisions we make. And we need to do better. And so I agree wholeheartedly that we need to compel the federal government to take a stand. We're less than a year away now from the next federal election campaign getting started, and there will be a opportunity in May of this year to speak with the united voice from communities across the country as Vibrant Communities Canada hosts the first National Poverty Summit in Ottawa. And we'll have representatives from our table there as well as from other tables across the country. And we hope to ensure that all the federal parties take this issue very seriously. I was pleased that the federal NDP recently committed to a $15 minimum wage for federal workers, and that will certainly be helpful in creating a space for dialogue, I think. But in terms of all those things you mentioned, in terms of a national poverty strategy, national housing strategy, a national child care strategy, we really do need to have perhaps an uncomfortable but necessary conversation on a national level about all of those things.
Mr. Chairman, another fact that really perturbs me greatly is the miscommunication, the misleading information that the public generally consumes through the media. And again, because of the lack of real focus and the focus on irrelevant, if not really laughable issues, what we find is that the average person has no idea about who pays for what and who's responsible for what under the Federation of Canada. And I have no one to blame except, I guess, the media who are focused in on some of the more irrelevant, if not insignificant issues. But collectively, we need to come together as a community, as a province, as a country, to basically set down what the challenges are and not what they're being fabricated for whatever purpose. And how do we go about, through you, Mr. Chairman, educating the public about what our real challenges are rather than the fabricated ones we read and hear about?
Question, Tom. How do we go about it?
How can we start locally to start a provincial and national-wide movement?
Yeah, I appreciate the question, Councillor. I think part of what we've been doing locally through the leadership of Celeste and the Speak Now Speakers Bureau goes part of the way there, and it's really breaking down those stereotypes and reminding the public about the importance of investing in individuals who experience poverty. You'll recall in the last municipal election, there was a Nick Nanos poll that appeared in the Hamilton Spectator that indicated that 80% of voters in this community believe that poverty reduction should be a priority. And Howard could correct me if I'm wrong, but I believe the pollster said that was the first time he'd seen any response similar to that in any community he's worked in. I think Hamilton is being looked upon as a leader in addressing many of these issues, but we really do need a ground-up approach, particularly when it comes to the federal government, but certainly the provincial government as well, in terms of highlighting the importance of investing in these issues. You can't have a healthy society when, as Councillor Whitehead indicated, that the wealth rests with 20%. We need to build a much more equitable society. There's opportunities to do that, but again, it will really, I think, require all of our efforts to talk about the realities facing individuals living in poverty.
And through you, Mr. Chairman, the reality is that we have the most regressive form of taxation in the province of Ontario in Canada than any other jurisdiction in the entire Western Democratic Hemisphere. When you have 50% of your operating have nothing to do with city politics and is being paid for on a general levy. So when the fact is, when the vast majority of residents don't understand that, there is a collective failure on the part of everyone that communicates in this community accordingly. So we need to hold everyone accountable to firstly wake up and smell the coffee and educate themselves, particularly those in leadership roles in the media, so that the public understands it, because nothing will change until the public demonstrates an understanding of why it should change at the ballot box. And without the help of a professional media sources and those non-professional media sources, we need to work diligently on informing the public, because nothing will change because they're part of the problem rather than the solution.
If I could just jump in very quickly, I think locally there's been some strong commitment to that, certainly from the Hamilton Spectator and having
Necessarily, but
having our chairs.
Andrew Gress has been very, very accurate on this one.
But I would certainly agree that in terms of shifting attitudes, there needs to, on the national level especially, we really do need a new conversation to take place.
One other thing, Mr. Chairman, on the issue of the living wage, one thing that I recently met with a couple of musicians I grew up with, and they, it's amazing how musicians are always expected to actually perform and do it as a favor as opposed to being paid for it. I'm wondering through you, has there been any formal discussion regarding the formulation of a plan to include musicians in this living wage formula? Because I believe they've been excluded in the past, and if we can extend that beyond just musicians to artists as well, I think it would be a fair initiative, understanding what the renaissance we're going through in this city, not only from an economic perspective, but also the arts industry as well. So through you, Mr. Chairman, has there been any thought? If not, could we formally address that today?
Yeah, through you, Mr. Chairman. There hasn't been any formalized conversations with the artistic community around living wage. I think that's an excellent idea, though, and certainly recognizing that artists are also very often not earning a living wage, and we would certainly want to look at that. I think that's an excellent recommendation for us.
I truly appreciate your time, sir, and I look forward to continuing to work with you, but particularly we need to really focus on having the public understand what our challenges are, because I think we know what our challenges are on this table are. We need to communicate that better, and I'm trying to, in many ways, implore the media to work with us rather than against us, and I look forward to that. Thank you.
Thank you. Good comments and questions, and you may want to whisper to your colleague to your left on what Madeline and Tom Wilson are doing, particularly with musicians of late, and certainly getting them involved in this poverty roundtable conversation. Tom, thank you very much. I don't think there's any more questions. Very much appreciate the presentation, and move to receive Whitehead, Partridge, both councillors, of course. Thank you very much. Moving on. Under changes to the agenda committee, item 7.1 will be on a future meeting agenda, so we move on to 7.2. Mark Weingardner, Senior Policy Analyst for the City of Hamilton, is going to come up and present respecting 7.2. This is Hamilton's plan for an age-friendly city. And he's with Margaret Denton. Margaret's from the Hamilton Council on Aging. Is Ron coming? Ron coming down? No? Okay.
Excuse me, Mr. Chair, before we get started, Paul has a few introductory remarks.
Paul Johnson?
Yes.
Go ahead, Paul.
Through the chair, this afternoon you're going to hear a presentation on our plan for an age-friendly city. It is a plan that has brought together the community as well as staff. I just wanted to say a word of thanks to Council for providing direction for us to move on this important topic. We've done so in collaboration with the community because that's the right way to build this type of a plan. I also want to say thank you to the senior management team, and our city manager Chris Murray is here not only because he's passionate about this issue, but also he's the sponsor from the senior management team for this initiative. So with Joanne's leadership and Chris's guiding hand, we've had good support from our staff team around this. I do want to also highlight for the committee that there is one numerical error in the report. On page 6 of 10, we talk about the percentage of Hamiltonians who are 55 years and older. The percentage is correct. The actual number of Hamiltonians is listed as 81,575. In fact, that should be 147,800. And through the chair, hopefully through clerks, we can amend that report when it's finalized and ratified. And not to worry, all of our materials are in draft form, and before we do any kind of more significant printing, we'll make sure that all those numbers are accurate. My apologies for that oversight.
Anybody want to move to amend the number on page 6 of 10? Moved by Partridge, seconded by Councillor McCaddy. Madam Clerk, that goes from, Paul, once again, 87 to 140.
The change, and I'll provide this to the clerk through the chair, the change is from 81,575. The correct number should be 147,800.
All in favor? Carried. And that'll look good upon ratification. Thank you for the note, Paul, and thank you for the introduction. And of course, City Manager Chris Murray, for your fronting this file and certainly sharing with Council whenever you've had the opportunity your focus on this issue. It's important to us. All right, on with the presentation, and we'll have some questions and comments from committee.
Okay, thank you very much for the opportunity to address you today. What I've been asked to do is to give a little bit of background to the development of the plan, and then Mark's going to talk about how we developed the plan. So as you know, we're all facing an aging population, and in Hamilton, when we look at the figures, you can see that 28% of the population in Hamilton is actually over the age of 55, and you can see the little blip behind that with the baby boomers fast approaching the age of 55. And as a result, today we have about 28% of our population over the age of 55, and that's going to move up to about 31% by 2021. So as a result of population aging, the World Health Organization came out with their response to that, and which they call Global Age-Friendly Cities, a guide. And what that is, it's an effective local policy approach for responding to demographic aging. This is an initiative that is actually going worldwide as different cities and communities begin to work towards establishing policies, programs, services, and infrastructure that support the physical and social environment designed to enable older people to live in safety, enjoyment, good health, and well-being while continuing to participate in society in meaningful ways. So the Hamilton Council on Aging, we're a volunteer board, and we have been actually working on coming together to work towards a common vision of an age-friendly Hamilton since 2008. At that point in time, we actually applied for and received, first of all, the World Health Organization basically talks about 4 steps to an age-friendly city. And they talk about the first step is planning, defining your principles, assessing your needs in your own city, and developing a plan. The second point is implementing that plan, later evaluating how well you've done, and then continuing to, going on with the next phase of the plan. So it's a process of continual improvement towards going to becoming more age-friendly. So the key or the route to becoming age-friendly is through an older adult plan. And presently, there's actually about 900 communities in Canada that are working towards an age-friendly community. Hamilton was actually the first community in Ontario to start that process, and now there's probably about, I don't even know exactly the number, but I'd say about 40 communities who are working on that initiative. So, and 12 have actually been designated, in Ontario, 12 have been designated by WHO as working towards age-friendly cities. So the Hamilton Council on Aging actually applied and got some Trillium money in 2008 to begin working on this process. And the way that WHO says you should do it is to do focus groups, to do community development, to do focus groups across the community, and from that identify what the barriers and challenges are to an age-friendly city, which we did, and we came up with actually 92 recommendations to make Hamilton an age-friendly city, and it was endorsed in 2009 by the City of Hamilton. But we soon realized that we can't do this alone. It can't be just the Hamilton Council on Aging trying to make the city age-friendly. So we decided to engage a collaborative across the community to help us work on this process. So with our second Trillium grant, we developed a community collaborative, and they included members from the United Way, the Social Planning and Research Council, the Senior Advisory Committee here in the city. And the City of Hamilton, under Community Services, we were working with Jane Soldera and Vicki Woodcox at that point in time. And one of our products was a second report 3 years on, where we actually looked at some of the recommendations that we'd made in our first report, and then we looked at, well, what's happening? We identified what some of the current initiatives were. We identified some of the gaps and some of the opportunities, and that is in our second report, which was produced in 2013. But we soon realized that we came together and we realized what we really needed to do was to work on a plan, a strategic plan, and that we needed to do this in partnership with the community, in partnership with the City of Hamilton, because neither of us, can do it by ourselves. So as a result of that, building on our collaborative, we developed a steering committee. You generously provided some money from the City of Hamilton through the community services to help with this process. And we've been working, our staff have been working very diligently with the staff with Mark to develop this plan for the last 6 months. So now, and you can see that with our steering committee, we actually expanded it to include other members from the City of Hamilton, from Seniors Recreation, from Accessibility, the Hamilton Center for Civic Inclusion, the YWCA, and the Hamilton Regional Indian Center, trying to be as inclusive as we could in developing this plan. So now I'm going to turn it over to Mark, who's going to tell you about how we developed the plan.
Thank you, Dr. Denton. So in April 2012, City Council identified the development of an age-friendly initiative as part of its strategic priorities in the city's 2012-2015 strategic plan. In 2013, the Neighborhood and Community Initiatives Division partnered with the Council on Aging and the city's Seniors Advisory Committee to begin this work. Hamilton's plan for an age-friendly city is the result. I think Dr. Denton has covered most of this slide, so I won't repeat that. I would like to just say a few words on definitions. For the purposes of this report, the term older adult will refer to a stage of life rather than a specific age. Typically, individuals that would be considered older adults are in their mid-50s and older. In the plan, when we talk about seniors, we'll be referring exclusively to individuals who are 65 years of age and older. So how was the plan developed? Hamilton's plan for an age-friendly city was informed by and aligns with the World Health Organization's Age-Friendly Cities framework. If approved, Hamilton will join a growing global community of practice that aims to make cities more inclusive for all ages. We also reviewed research and best practices in public policy and aging, other municipal, older adult, age-friendly, and senior strategies, existing city policy frameworks and strategic plans to ensure Hamilton's plan aligns with and builds on comprehensive strategic work that is already underway. The plan links to the Housing and Homelessness Action Plan, the Pedestrian Mobility Plan, and Rapid Ready, to name a few. There is also alignment with the mandatory accessibility standards for people with disabilities being developed under the Accessibility for Ontarians with Disabilities Act, or the AODA. Over 700 community stakeholders, such as local seniors and older adults, members of the Aboriginal community, residents living with a low income, persons with disabilities, residents from various ethnocultural communities, urban and rural residents, community agencies, and city staff were also engaged in and contributed to the development of the plan. Consultation with these individuals and groups was critical to the development of a comprehensive plan, and it will continue to be essential as we move forward with this work. Here's a brief breakdown of the people we spoke to. Over 100 community stakeholders, 48 city staff, both management and frontline, and over 550 older adults in the community. So what does the plan look like? Hamilton's plan for an age-friendly city outlines a vision and identifies principles for policy planning and service delivery. The vision essentially says that as a city, through the execution of this plan, our older adults and seniors will feel more engaged in and connected to their community and feel more supported in their community and enjoy a better quality of life as they age in place. The plan is organized around 7 areas of focus or strategic goals and commits to a series of objectives and actions to achieve these goals. I'll briefly highlight those 7 goals. Goal number 1, housing. Appropriate housing is one of the most significant determinants of quality of aging. Our objectives and actions relative to this goal center around improving access to housing information, improving housing affordability, stability, and choice, creating a more user-friendly, person-centered social housing system, and ensuring older adults have the supports they need to help them obtain and maintain housing. It sounds somewhat familiar. It's adapted from the city's Housing and Homelessness Action Plan. Again, we wanted to build on good work that's already out there. Goal number 2, getting around Greater Hamilton. The Greater Toronto and Hamilton Medical Officers of Health have identified severe negative health impacts that result from how communities have been designed to rely on cars. They assert that increasing physical activity can help prevent premature death and chronic disease, and that planning healthy, compact, complete communities is needed to support greater use of public transit and active transportation. Our objectives and actions relative to this goal center around ensuring that this plan informs the Master Transportation Plan, investigating the feasibility of shared ride, volunteer driving, and community bus shuttle programs, improving the ease of use of public transit, and exploring the development and implementation of a complete streets policy. Our third goal is around communication and information. There is a general lack of awareness amongst seniors and older adults of programs and services available to them. And that challenge worsens in instances of a crisis. Our objectives and actions relative to this goal center around increasing awareness of programs and services, improving communication between the city and older residents, increasing the digital literacy of older adults, and increasing the nonprofit sector's access to assistive devices and translation services. Goal 4, health and community services. While this consultation did not focus on health, health is a significant concern for older adults. It's difficult for people in stressful situations to navigate the system, find information, and access services. We as a community need to do a better job of coordinating services in order to provide a more seamless experience for our residents. Our objectives and actions relative to this goal center around improving access to supports that help older adults remain safely in their homes and ensure that older adults have easy, seamless, and equitable access to services that cross the continuum of care. Goal 5, social participation. Older adults need to stay connected. Social connectedness is important in maintaining physical and mental health as we age. Our objectives and actions relative to this goal center around ensuring there are recreation, leisure, and cultural activities for older adults throughout Greater Hamilton that meet their diverse needs and interests, and designing facilities that serve seniors and older adults. Goal 6, civic engagement, volunteerism, and employment. Civic engagement contributes to social well-being of both individuals and the community at large. It helps people find meaning in their lives, and volunteers consistently report that they get more out of volunteering than they give. Yet many people do not volunteer. Our objectives and actions relative to this goal center around ensuring there is a range of meaningful volunteer opportunities that use the gifts and talents of older adults in service to others or the community, and ensure that older adults are valued as employees. And our last goal, age-friendly public service. Client-centered service that recognizes the unique needs of older adults is an integral part of an equity and inclusion approach to public service. The City of Hamilton is a large organization, and it is challenging to ensure pertinent information gets out to the right people, and for staff to know what others are doing. Our objectives and actions relative to this goal center around ensuring that the development of all planning and programming of policy frameworks and city services uses an equity and inclusion lens, and ensuring that policies, programs, and services for older adults in Hamilton are aligned with promising and emerging practices, such as the World Health Organization's Age-Friendly Cities Framework. They also center around increasing the ease of interdepartmental collaboration and coordination in planning for and serving older adults, and engaging the community in the implementation of this plan. In conclusion, I'd like to summarize the report's recommendations. Staff recommend developing a detailed implementation plan, which would include identifying timeframes and necessary resources, as well as developing an evaluation framework to monitor our progress. Continuing to engage stakeholders and provide regular updates to Council and the community. Continuing to partner with the Council on Aging in this work, and requesting $50,000 through the 2015 capital budget to support this work. And lastly, applying formally to the World Health Organization's Age-Friendly Cities Network. Thank you for your attention, and I'd now like to turn the podium over to Mr. Ron Smithson, the Chair of the City's Senior Advisory Committee.
Thank you. A lot of the things we do in the Seniors Advisory Committee parallel what Mark has been saying, and you have them in front of you, but I want to point out something this year, this term, which was different from other years. Other years we didn't have enough members to split up into 4 groups, and this year we did. So we had 4 distinct groups that met separately and came together, which reduced the amount of time taken in the meetings, and we got more done. Those 4 ones is an age-friendly city, recreation, transportation, and housing. And we have gone through quite a few scenarios, and we also got into the age-friendly bus pass, and we've done quite a few other areas of the kind, but it's all there in this report. We're very happy to have Councillor Jackson as a commander, and also Bernie Morelli, and Councillor Jackson did fill in for the loss of Morelli. So a lot of the things we do are much, as Mark just talked about. I would like to thank Councillor Jackson and what happened, and Morelli for what it was done for us in the seniors, because seniors has always been on the sideline. We don't make money. We do try to help to make this city a better place, and I don't think I can add anything more unless you have some questions for it.
Okay, that's the presentation. We do have questions, and it could be for any and all of our presenters, and it begins with Councillor Partridge.
Thank you, Mr. Chair. And I'm going to begin with Ron, since Ron, you're at the podium. And I just want to mention that Bill Wright from Freelton is on your advisory committee. Right. And I also have a seniors advisory committee in Flamborough with representatives from all across the ward. And Bill does a great job filling us in on what the work that's being done at your committee, and it's really quite helpful and quite appreciated. So that's the only comment I wanted to say, is just how much we appreciate all the work that everyone is doing. But through you, Mr. Chair, I do have a couple of questions, and I'm not sure if it would be Margaret or Mark. But back in May, we had our workshop in Waterdown, and it was very well attended. I don't honestly remember if either one of you were there, but I know that Denise was, and Mark, you were there, and I think there was around 70 people that attended. And everyone was again, quite wanting to be engaged in this whole process. Some of the things that we heard from them, and that I hear from them clearly every day, is affordable housing, especially for the seniors. And seniors, the demographic in Flamborough, Ward 15, seniors is the fastest growing demographic. So the housing, availability for affordable housing is one thing, but the rural isolation is another part of it that is really quite it's quite worrisome for many of them as they're getting older. They don't have access to transportation, especially if they don't have their own vehicles or if they've had their driver's license taken away. And so my question is, how are you going to address that rural isolation and the issues that go with that for seniors?
Well, I think that in the plan, the areas around getting around Greater Hamilton, so transportation, mobility, certainly would have an impact in a specific way on rural residents. I think also the social participation, again, being able, it links to transportation and mobility, getting out to either appointments or to events or recreation, etc. So I think that there are elements and objectives and actions in the plan that speak to the areas that you're talking about. I don't know that I'm answering your question that well. I don't know specifically how we will address those, but I think the questions, the actions are in the plan. It'll be a matter of, as we flush out some of those things, that we would have to look at how they would differ in a rural setting as opposed to in a more urban setting.
So you didn't answer my question, but you did in some ways, because what I'm hearing is you clearly don't have a plan. You're starting to unpack a lot of the information that you've received. My point really is to ensure that the needs of the rural community are high on your radar, because they are so very, very different than the rest of this city.
Okay, we have Paul Johnson can assist.
Oh, absolutely, Mr. Johnson.
Through the chair, just to add to what Mark says, I think the foundations are in the plan, and now we're thinking about implementation. And I remember very clearly when we had a pre-meeting out in Flamborough that even pieces around postal code was important for us to get right, because not always did postal code indicate the separateness of some of the areas there. We're going to have to be far more creative than simply looking at the current system that's in place. And so part of the next phase of this work is to actually drill down. And if there's one thing we learned as we went around to the various sessions is that we will have to be very specific geographically, as well as some of the universal pieces we need as to how to get at that. So I think today, in terms of here's the strategy, the answer is no, but the foundation is there. We know what the huge issues are, and you've named two of them, and not surprisingly, those are actually the first two we talked about on our slide deck. It's about where you live and about how you move around this city, and a traditional growth approach to what we already have may not suffice, because the population is moving at a clip faster than our systems are. So we're going to work with individual jurisdictions within the city and with the councillors that represent those areas to figure out exactly how we can build creative solutions that are unique to different areas.
Thank you, Paul, and through you, Mr. Chair, you raised another issue, because it is a prime concern to me that our population, our demographic is aging faster than we are. Then we are putting programs together and ways of servicing them. And that is a huge concern to me, because it's, again, we're talking rural isolation, and I know those two words come out of my mouth, I think, every time I see you, Paul, and we've had that conversation before. Through you, Mr. Chair, coming back to our presenters, is there any representation on your advisory board from the rural area?
Yes, there is.
Sorry, Ron.
Yes, there is, but I don't, can't think of the person who it is at the moment, but we do have.
Yes, you do, Ron, and it's Bill Wright, who is from Freelton.
Right, yeah.
So I thank you. I was actually directing my question. I should have said steering committee, not the advisory committee. So the steering committee on the Council of Aging on this particular program, is there any rural representation?
The project steering committee that guided the development of the report, there isn't a specific member that I would designate as rural. It was primarily members of the Council on Aging, some community stakeholder partners. If you look at Appendix B, I think it's a listing.
I did see the list, yes.
But there isn't somebody that I could identify specifically as a rural representative.
All right, thank you. And through you, Chair, that concerns me, because I will tell you, and I have been on hundreds of committees over the last 20 years, and at so many of them, there is absolutely no one thinking from that rural perspective. And if you don't live there, and if you don't understand the issues, they won't be raised. And we can all, I think, agree with that. They will not be raised. And that is why, to me, it is so very, very important. I'm the voice of the seniors that are in the rural community right now. And I want to absolutely ensure, and through you, Chair, to Paul, that we do not lose focus on the rural issues, because they are growing and they are getting serious. And I'm very, very concerned about my residents who are living that right now, and they're worried as well.
Looks like Dr. Denton and then Paul.
We had a meeting of our steering committee last couple of weeks ago, and we talked about where do we go from here. And we thought we need to sort of reformulate into kind of an implementation committee and add more members. So your comment about adding someone from the rural community is well taken, and we'll consider that as we expand the implementation committee.
Bless you. That's wonderful. Yes, Paul.
And through the chair, just to further strengthen that, the steering committee that came together was helping us to drive a process to develop the plan, very much looking at how we engage the community and do that well. And I think we received input from a variety of sources within the community. When we now look at the priority areas and how to move that to implementation, we will need to review the membership, not only to address some of the issues you've raised geographically, but also when it comes to some of those specific activity areas, we will need expertise from the community in those particular areas to drive the right kinds of solutions to bring forward for your consideration.
Thank you, and I do appreciate that. And certainly, if you need names, through you, Mr. Chair, of anyone to be a rural representative, I do have several people that I could certainly contact and ask them to get in touch with you, who would be able to speak with a clear voice for the seniors that live in the rural areas. And I include Waterdown. It's the only urban area, but it is very different from the other urban areas of the city as well. So I don't want to forget my Waterdown residents. Thank you.
Yeah, Waterdown shows up on the map here, that's for sure. Councillor Jackson.
So thanks, Mr. Chairman, and Dr. Denton and Mark and Chairman Ron for your presentation. Mr. Chairman, if you just, before I get to a couple of questions, I'll just right off the bat say item 7.2, I'm going to fully endorse from a general standpoint the age-friendly city concept, which council endorsed about 5 years ago, but the implementation of it, I just want to get it right on the table. It's moving us forward. Now, having said that, if Paul Johnson and General Manager Joanne Creel recall, months ago, a year ago, and I've got questions for Dr. Denton and Mark. Dr. Denton's presentation talked about older adults and 55 plus in the aging population from 55 up. Mark said we don't want to focus on 55 up under the definition. We want to refer to it as a stage of life. Dr. Denton's presentation, which I greatly appreciate, and I have met with Margaret before over the last 2 or 3 years at coffee shops to go over our passion overall for seniors in our community. My worry is transitioning the older adults seems to be the emphasis of what I've heard today. And I said, let's not lose sight of seniors. There's two categories currently, Mr. Chairman. This is a question to Margaret and to Mark, of seniors. There's shut-ins that are the real frail elderly and the older seniors that are shut-ins. I heard nothing about that today whatsoever, servicing them. And there's seniors who Chairman Ron Smithson and his committee, primarily the 65 and up, who are still active, have most, if not all, their capacities to do what they can for many thousands of seniors in our community. Mark referenced some of the seniors in his presentation and handout. So, Mr. Chairman, through you to Mark and Margaret, it seems to me today that the older adult, 55 and up, and believe me, most of the people I know in that category, yes, there's some that have issues, that may be single, that may have housing issues down the road, that may have income issues, have lost a loved one prematurely in life. I get all that, but most of us in that older adult category currently want to continue to serve the seniors and the shut-ins. Mr. Chairman, through you to Margaret and or Mark for a comment, please, on that.
So in Brantford, they talk about those three groups as the go-go, the slow-go, and the no-go groups. And one way of approaching it is, as we're looking at our recommendations and how we're going to implement them, the various actions, we actually think about those three groups because the implications are different, depending sort of where you are in your lifespan. So we do have that in the back of our minds, I always tell my students that older adults are a very heterogeneous group, more heterogeneous than even younger adults. And so we can't just have one plan that fits all. We have to make sure that in our planning that we're addressing the needs of people of various sort of health situations or mobility situations.
Okay. Mark, any comment as well, please, from staff standpoint?
Certainly. I don't think we've lost sight of either the 55 to 64 or the 65 and up. I think, as Dr. Denton said, as we approach the various objectives and action items, we need to look at, how actioning them would impact those different age groups. So, for example, when we look at social participation for someone 55 to 70 might be very different from social participation and actions that we need to take for someone that is frail in their home or isolated somewhere else at a long-term care facility, wherever they might be. So I think really it's now when we look at implementation, how do we take action and consider the different groups within this, older adults or seniors label.
Thank you, Mark. Chairman Ron?
Just add to that, you can't say by age because some people are frail at 60 and some people are not frail until 90 or older. So you can't put it by age. You'll have to take it as the groups are and the conditions each senior is in. And they vary drastically from one place to another.
Thank you, Chairman Ron. I'm encouraged by what the three of them have said, Mr. Chairman. However, the number of seniors that I bring no professional designation to the table like people do at the front there, at the two of the three presenters do in terms of their degrees. But what I bring is community feedback and my constant involvement with seniors, literally before I entered politics and since. And many seniors and the Seniors Advisory are very proud of their title of seniors, that they've reached a point in their lives that they can acknowledge and be very proud of. So I hope this isn't leading down a road to somehow blending and merging a category of 55 until death do us part as an all-encompassing older adult category. Lastly, I heard nothing about from the multicultural community standpoint, and someone who's of a multicultural background, there's often language and cultural issues that are involved there, but I didn't see anything about that. Mr. Chairman, through you to either Dr. Denton or Mark for a comment on that, please.
I think, again, we do address those things, but at a lower level in the plan. So under some of the objectives and some of the actions, I need my glasses.
Maybe, Mark, as you're looking forward, if that kind of could have been maybe a bullet point up there between you and Dr. Denton, if you're saying, Tom, it's implied, it'll be there, wonderful. I'm happy for the record it is. But if that had been a bullet point, if the separation of the shut-ins and the seniors and the older adult, again, defining what I think is really out in the community as we're trying to accommodate all, I just think for the record, that would have been more visual and visible, Mr. Chairman. Through you to Mark.
Okay, thank you, point taken. There are examples I can't really find. I don't want to take up everybody's time finding them, but I assure you they're there.
Okay, thank you very much. And again, Mr. Chairman, when we get to 7.2, the concept and the implementation, I'm happy as we're moving forward with it. Thank you, Mr. Chairman.
Councillor Whitehead.
Thank you, and I really appreciate the presentation. As a council that represents the highest senior population in the city, this is so important to me when I attend every function, from St. Elizabeth Village to Extended Care to St. Peter's to Idlewild, and just meeting seniors in their homes. A couple of things have come to bear, and that is maybe some of the pressures in seniors who want to stay in their home, which is certainly an objective that I think we can all agree with. They're healthier when they can stay in their homes as long as they practically can, but there are certain limitations. Taxes. So what has happened in my situation, many of the homes were bought at $50,000, $60,000, $70,000, $80,000. Based on whatever their salary was at the time. But through a reassessment and impact, those homes now have fairly significant value, which obviously equates to the taxes they pay, but their income hasn't gone up any higher. So what's happening proportionally, they're paying more out than when they entered into this contract when they bought their home. So one of the biggest challenges I'm hearing at the door from seniors is that they want to stay in the home as long as they can, but because of these implications, there's value in the home, they can sell it, but their desire is not to leave the neighborhood, not to leave the supports that they have in that neighborhood after 40, 50, in some cases even 60 years. So I'm just wondering, are you getting feedback on those kind of financial realities and hearing anything about that in regards to how we might affect a change? Now I know that you got banks coming out and talk about reverse mortgages, those kinds of things. I had an individual whose wife, because of the health, was put into Idlewild. He lives in the neighborhood, so he can commute, but the cost of that home was fairly significant. He had to sell his car off. He's pretty well sold every asset he has other than his home, but he's finding it very challenging every time the taxes go up. Are you hearing those kind of stories?
Mr. Chair, yes, we did hear that some of the times during our consultation, and I know it's showed up in other types of research that it is a concern of folks, yes.
Have we have empirical data that might assist us in understanding, demographically, I think we're pretty good identifying the age groups within our areas. Do we go the next level and break it down in regards to the social economic relationships in that age group?
Dr. Denton?
A couple years ago, the Social Planning and Research Council did a report called Profile of Low-Income Seniors in Hamilton, and included, demographics basically of all seniors, but the report really focused on those in low income. So that information, it's a couple of years old, but that information is available through that report. It's interesting because we've often wondered why the World Health Organization didn't identify economics or financial situation as one of their 8 dimensions of an age-friendly city. And so recently sent an email to one of the planners who worked at the World Health Organization and said, well, why, this keeps coming up. It comes up in our steering committee. It comes up. I also organize a network in Southern Ontario of communities who are trying to work on becoming age-friendly, and it's an issue there too. Is why aren't economics one of the dimensions? And so when I asked Louise Plouffe about it, she said, well, because it's a cross-cutting theme. It shows up in the various dimensions, such as people who cannot afford to participate, because they can't afford memberships or whatever, or issues around income and housing, or issues around income and transportation. So it's like a cross-cutting theme. So we're sort of struggling because part of it is that cities aren't really, it's the federal government, right, who basically has the income support programs. And so I think that's probably one of the reasons they didn't put it in as a dimension, but it is a huge issue. I know the Council on Aging, one of our strategic areas is kind of poverty and aging. What can we do about poverty and aging, increasing people's awareness, for example, of the guaranteed income supplement, because there's lots of people in our community who don't even know that they're eligible for a guaranteed income supplement. So I think, we want to address these kinds of issues, within the purview of our community, but I don't know what else I can say about
And that
it.
document,
it's an issue.
the document you referred to is from 2 years ago, Social Planning Research Council, and it was entitled again, Margaret?
Exactly what year? I lose track of the years these days, but it's called A Profile of Low-Income Seniors in Hamilton.
There you go.
It's on their website.
Thank you.
It'd be interesting to see how that's trending. I guess my last question is, I'm coming across a lot of seniors have lost their spouse. They're still living in their home and don't have a lot of supports and feel completely isolated. I'm not clear what services we have. And I stopped by one senior's home and lost her husband about 4 months ago. Very isolated. Her family lives out west. So I spent a good hour and what was really interesting was it was just having somebody to talk to and share stories with, and you can see the glow on her face when I left, that she just appreciated having somebody to share her stories. And so I'm not sure how that feedback is coming back through your analysis, but I don't know if we do enough to identify those individuals in our community and how we might address that shortcoming. Do you have any comments on that?
I'm commenting on that because it affects me, because my wife died this year, and I try to keep involved in things. That's why I'm on this committee and some other committees, not just this one, but many other committees. It keeps me going. Now, that's not good for everybody, so we have to look at these other ones that are kind of on their own and don't want to get involved and see what can be done. But I understand there's two sides to that coin.
Thank you. Councillor Duval.
Thanks, Mr. Chair, and thanks to our guests for coming and making their presentations. I know you're tired, so I'll be short. When you're consulting with some of the peoples, are we consulting with the planning department and our roads department and our HSR department? And I'm talking about the accessibility part of this, because I really truly believe we have to have a plan, and I think it's great work for our aging people. But when we're doing planning, we're not planning properly for people to make access to bus stops that have pads. We still have Rimo Road that's growing, and we basically put them out to the side of the road where there's no asphalt for their walkers or anything like that. There's no shelter protection. And it takes years. After these developments are built, it takes years and years to get it just to the next stage. So
it's very interesting. It's hard to get everything done at the same time, but everything we've done in this last year in the Seniors Advisory Committee has been an advance towards those things. But you can't go from nothing to everything in a short time. So we're working on it, gradually getting more shelters have been put up in this last time. We identify these and other areas where it helps the seniors. And that's basically what we've been trying to do for the year. And I thought we had done quite a bit this year. I shouldn't say this year, this term. And there's still a lot to do. And that's what we're working on.
Okay, so, and I thank you for that, Ron, but I'm saying in the future, like when you're having these consulting groups, it's very important, I think, that those, you have representation there, so that message gets back, even for future development, grocery stores, all right, I mean, they should be putting the pads in, they should be, we shouldn't be waiting after 15 or 20 years after this has already been built.
Yes, I agree with you. We can suggest a lot of things, but unless the city wants to go for it, then you can't force them, eh? But anyway, we're trying to do the best we can, and we do get people in to give us the feelings on how the various areas are working, and that's been done all the time.
So I take it then, and you're going to come back with a plan and come forward. So some of these recommendations will be coming to this council to say, in the future, when this happens, these are the things we need.
That's
so
what we're working towards.
Is that what we're talking about?
Mm-hmm.
Hey, Chris Murray would like to comment to your planning question.
Yeah, if I can, thank you very much, Chairman. Just the reason why I was interested in this is I recognize the answers to many of the challenges that we're focused on here are going to be, will have to be addressed by a number of the departments that work for the city. So it's not just a planning matter, it's clearly a planning matter, a public works matter, it's also a finance matter, a public health matter. It will take the concerted effort of all our departments to really make what is a great plan into something that is going to be quite effective when implemented. So a lot of the questions that you're asking right now really speak to the fact that, Joanne and her SMT colleagues, including myself, realize that for us to become really a really successful age-friendly community, this is another example of how the departments have to work together to kind of address the needs of this population that is already significant and is going to get even more significant in the next decade. So we will be with council every step of the way, giving you the best advice as we can to make improvements right across our board.
Thank you. I myself on the list, but first, Councillor Jackson, there's a few people you'd like to recognize.
Mr. Chairman, thank you. Chairman Ron and I, we serve also, and they've taken the time to be here today, two members of Seniors Advisory, Penelope Petrie and Jan Mayo. I just want to acknowledge their presence. They took the time to be here today in support of this project. Thanks, Mr. Chairman.
Thank you very much, and thank you for coming. And Ron, may I ask first through who wants to be chair? Councillor Duvall, through you. Are you going to speak to 8.1 as well, or did you put it all in one here?
Well, I'm trying to put it, I thought we're putting it all together.
Okay, well, you're invited to if there's additional comments you want to add as it relates to your...
It's all before you is what we've done.
Mm-hmm.
It's not, we've done quite a bit as you go, and if you look at the report, there's quite a number of things that have been done, but there's still a lot more to do, and especially in age-friendly city areas. And that's what will have to be carried on to the next committee that is formed for the seniors. And even the other ones, housing and recreation, always something that comes up that needs to be done, and that's what we're looking at all the time.
And I read the report, and you alluded to it on a few occasions, and in my conversations with Councillor Jackson, it really has been a phenomenal term for the Senior Advisory Committee. There has been a great deal of support, I think, from around this table, and you would acknowledge that through you, Chair. Yeah.
And it helped because we had more members on this term than we did the term before. And so consequently, we were able to split up into 4 groups, and each group did their own thing, brought it to the main committee to pass it, so that we're not spending arguing back and forth at a main meeting on issues.
Well, it's clear with what's before us for approval today as a first step moving forward in as a corporation planning for the aging population and those many that are already there, that you are a crucial voice. The committee is a crucial voice in this process. Having you up here as part of the presentation, I think, was important. And certainly I'm hopeful that for many terms of council to come will continue to embrace your ideas, listen, and action a lot of those items that emanate from your group. So thank you so much for that. I read a book probably 25 years ago now. Not just one book, Councillor Marula.
Is that the last one?
It's called Boom Bust Echo, and it was Dr. K. Foote, is a Toronto guy, and I think he recently came by and spoke. It is old, but it's come to life and come to bear now. The book was an economy-based book, and it was focused on Canada, but it talked about the booming demographic and the baby boomers becoming 55 plus. And one of the prevailing of the many messages, and it was an important book, and it stuck with me because here we are 25 years later, and I'm on council and bringing up the important information that came out of this study, was the prevailing message, one of the prevailing messages anyway, was that there is going to be, from this bulk of the population, the 55 plus, demands. There's going to be considerations that there's going to be expectations that their considerations will be met. And I think that we have in 4 years, like I say, maybe in an unprecedented fashion, have met them. But there's so much more to come. And I'm so glad that there's a focus from the city manager as a priority on this, because you and your demo, 25 years ago, I learned, expect nothing less. So whether it's sidewalk improvements, bus shelters, more work in the area of transportation, whether it's making sure this body holds staff's feet to the fire on making a priority of implementation our pedestrian mobility plan, which I was very proud to see unanimity on around this table, safe and complete streets, and all this emphasis on walkability. I mean, when you look at the Appendix A8 of 60, there's a great big blob here in the heart of the city. A lot of seniors want to be part of downtown. And of course, they add so much to the vitality of our downtown, or any downtown, and we want them to be part of the downtown. But there's little things like rubber tree bases all along James Street North that we put in with area rating funds to stop these grades from happening, these sharp drops from the screening that used to be there, and we're trying to do more and more, and sometimes those little things add up. So in short, to quote Dr. K. Foote, there's going to be demands, not to quote, to paraphrase, and we need to make sure that we're always listening, because it's expected from this demographic, and it is the bulk of our population. And certainly Hamilton has got challenges, no doubt about it. And in fact, we're at the higher end of that particular model. So on that, I have one question from a resident, and I think it's to staff. Thank you, through you, Chair, from one of my residents, who may or may not be a senior. It's a two-parter, and it had to do with having read this report as the senior or resident reads pretty much all of our emergency community services reports. On accessibility in pages 18 through 21, I believe, question specific to City Hall that I think I have the answer to. We voted on option 1 not long ago at a GIC, but to confirm through you, Chair, to staff, to get confirmation from staff, we're going to fix all these doors. It's just a matter of approving it in the 2015 budget. This facility we're in right now, all the meeting rooms, these doors behind us, we have to leave one ajar for accessibility purposes, will all be fixed. It's pending budget approval, true?
Through you, Chairman, that's my understanding, is coming through in the capital program for 2015.
That's a priority too, I think, Chris.
I believe so.
Okay. I know so. So that's that question. But then part 2, through you, Chair. I know I hate throwing those ones out that you already know the answer to, but this was from a resident, and I just received it before the meeting. The second one was all the rest of our facilities, recreation and so forth. Is there anybody here from facilities? What's the plan going forward on our other city-owned and operated facilities? To you, City Manager.
As you're well aware, AODA has been part of our agenda now for a few years in a whole variety of ways. So in terms of specific program for all of our facilities to ensure that they're compliant, I know there's deadlines in terms of just retrofitting facilities. I can't speak to exactly how all of that's going to be addressed in the upcoming budget, so that would have to be something I'd have to go check with Rome on, but clearly it's been a provincial priority, and we know there's substantial costs associated with it. I just can't speak right off the top of my head of exactly what we're doing.
And finally, from a technical standpoint, the 50K that we would approve here today, Mark, through you, Chair, is that for an FTE? It's under capital, so I'm just asking.
So through the chair, two things on that. Today would be to place it within the budget process. So it's not approval of 50,000. It's to approve it to be part of the capital discussions. It would be a combination of factors. It's not to hire staff directly. Some of it would be to continue our partnership with the Council on Aging, who have been helping us to implement pieces of this work. It really allows us to continue this work and bring you back the full implementation plan in 2015. But today's request is that it be placed into the 2015 capital discussion.
Today's request to, okay, great, and that's fine, and I'll look forward to seeing it there and supporting it there. We're endorsing today, through you, Chair, we're endorsing this plan today.
Through the chair, yes, the endorsement of the plan will allow us to move forward. Before we do implementation work, spend more money, come back with recommendations, we wanted to ensure that we were on the right track. So you're endorsing the plan as it sits today, and then we'll come forward with how we're actually going to take the actions that all of the members of the committee, and I'm sure other members of council, when it comes forward for ratification, will bring forward to us as considerations.
I think that's all the questions. I believe I'm the second time. Councillor Jackson, I'll take the chair back.
Mr. Chairman, a very valued member of Seniors Advisory. I overlook my deepest apologies. Mary Sinclair, always great to see Mary here as well. Thanks,
Excellent.
Mr. Chairman.
Thank you. Hi, Mary. So I have the chair back. We move to receive this presentation. Moved by Jackson, seconded by Marula. All in favor? That's carried. And thank you very much. I think at this point, we have a few folks who would like to speak on this. So before we move the recommendation 7-2, we'll have Denise Doyle, the CEO of the YWCA, come and talk to committee on this subject.
Good afternoon, councillors, and first of all, thank you to the committee. Great job presenting. I'm just here to support the presentation that was put forward today. I'm not going to reiterate all the important factors that they put forward, but I was proud to be a partner with the Council on Aging, all of the city staff who participated, community volunteers, and other community organizations. We've had a great time, and I look forward to continuing the work with all of you. But just to reiterate, the impact of this democratic shift on the design and delivery of municipal services will present opportunities and challenges. With this in mind, we urge you to be supportive, which you already are being supportive, and creative, so that we can develop an age-friendly community that supports older adults to live in security, maintain their health, and participate fully in society. The proposed plan proposes strategies for the city to adapt its structure and services to be accessible and inclusive of all older people with varying needs and capacities. Councillor Jackson, you had mentioned something about diversity and inclusion. I can assure you in the vision of the plan is clearly highlighted the inclusion aspects of the work that's going to be done. We need to ensure that we recognize the great diversity among older persons, promote their inclusion and contributions in all areas of the community life, respect their decisions and lifestyle choices, and anticipate and respond flexibly to an aging-related needs and for the city to work cooperatively with other levels of government, social profit organizations, businesses, and the community with the goal to ensure age-friendly status for all of us who live, work, and visit or play in our community. Thank you for supporting the report.
And thank you for all you do for seniors, Denise. Move to receive the presentation. Moved by Councillor Marula, seconded by Councillor McHattie. All in favor? That's carried. Thanks, Denise, very much. Next up is Angie Joshi from the Department of Health, Aging and Society at MAC.
Thank you for this opportunity. I've been teaching at McMaster University for about 25 years about aging, and I'm really pleased to see this progress being made in Hamilton. I am also a founding board member of the Hamilton Council on Aging, and currently I'm on the board of the Hamilton Community Foundation. So everywhere I go, everybody's talking about the aging population, so it's a good thing. But the fact that our population's aging isn't a surprise. We've known about this for a long time, about this baby boom cohort, and David Foote spoke about it early on. But to have so many older people living into old age, advanced old age, is something to celebrate. So, yet, however, a lot of politicians, government people, health and policymakers, and the media, they tend to talk about an aging population as a problem, as a huge problem. For example, just recently, there was a wonderful article in the paper, but it started with talking about the silver tsunami to describe the aging population. And to me, that's really troubling. A tsunami, and English is my second language, a tsunami is considered a natural disaster, which leads to death, destruction, chaos, and loss. So why we keep talking about the older population as a tsunami is beyond me. So older adults are actually our assets. We need to consider their strengths, their contributions, and how they can build our communities, instead of always talking about them as receivers of services. We couldn't actually function as a society without the financial and the practical support older people provide to their families, to their communities, to their neighbors. And their wisdom and experience and time are assets we can utilize to build stronger communities. And a stronger Hamilton in particular. So we need to create this social and physical environment that allows people to live to their full potential. And I think to address some of the earlier concerns, it doesn't really matter what age or what their functional ability is that we want to make sure they can live to their full potential. So it makes economic sense to support the older population to stay engaged, because if they become isolated, it actually costs our system more in terms of health support. And all the research, as Margaret Denton has pointed out, my colleague, that social support is one of the most important determinants of health, besides income as well. So we need to be able to allow people the opportunity to stay engaged in every way possible with their communities. So I'm particularly pleased to see this plan, and particularly about the principle of inclusion being mentioned there, because we have to be deliberate in using this inclusion lens in everything we do and how we do it. So too often, I think, we exclude people that have diverse identities and who may not be able to access information or programs the way others can. So I commend Hamilton, the City Council, and the staff for showing leadership in developing this plan with the Hamilton Council on Aging and with the Advisory Council. I'm here to offer help of my students in implementing some of this or doing more community engagement work. I have hundreds of students who I love for them to have direct contact with older people. And for putting this plan into action, I think it's not going to just benefit older people, but all the citizens of Hamilton. So I am thrilled to see this progress being made. So, thank you.
Thank you. Oh, can you take the chair? I have a quick comment and question. That was a brilliant presentation. I like that you want us to move forward trying wherever possible to look at this issue with positivity as opposed to the tsunami reference you made. I think that's extremely important. Is there anything in this plan that you have seen that gives you some assurances that we are heading in that direction, that, or is it something we may want to ask staff here as a committee today to contemplate as they bring it more forward to us? Be honest.
No, actually, I have full confidence that with the vision that Margaret Denton has had for an inclusion of older people in our society, that I don't think I would be worried. I think they're going to do it in the way that it needs to be done. So.
And very inclusively, I'm sure, too, which was also a great point. Thank you very much for your presentation. I'll take the chair back. Move to receive Councillor Marula, seconded by Councillor Brian McHattie. All in favor? That's carried. Brilliant. Thank you very much. That was really good. All right. Now, a motion on the report. Since he's a member of the Senior Advisories Committee as a representative of Council, to move the recommendations A through E in 7.2, Councillor Jackson. Seconded by Councillor Whitehead. All in favor? It is carried. On to discussion items. Right? Okay, thank you. Any questions with 8.1? And we heard from Ron. And you're good. No delegation required. You said a lot already, and we appreciate that. Okay, thank you, Ron. Moving 8.1 is Councillor Jackson, and seconded by Councillor Whitehead. And as a question for staff, Councillor Whitehead.
If I can, and I know that this sort of captures some of it, but I'm not between what's been recommended by the committee versus what's actually been implemented by the city in the last 4 years as it pertains to the aged and seniors. Do we have a thumbnail that you can send out to all the councillors in regards to action that the city has taken?
Through you, Mr. Chair, I'm looking at Vicky, who's the departmental rep on that committee, and she is nodding that we can provide that to council. We can look at the number of recommendations that have come forward.
That'd be great, because often, you know, when you're attending seniors, they say, what is the city doing for us? And it'd be nice to have a ready list that we can speak to. So that would be helpful. Vicky could send that to all council. Thank you.
So, Mr. Chairman, I support this, and the half FT will be for whoever's on council for the next budget year. Mr. Chairman, Lisa Maychuk's here, and I know she didn't do it alone, and she's very, very modest and a humble employee of our corporation. But I'll tell you, she was the driving force behind the magnificent gala that finally Councillor Morelli, God rest his soul, would have just been so proud if he could have attended. Over 600 people, 10 times what we used to get in past years. They were all wonderful, honoring seniors in the past, but they were small, little, intimate gatherings at Sackville's cafeteria. This was just astounding, got the awareness we needed for all categories of seniors, Lifetime Achievement Awards. Chairman Ron is a past winner of the Seniors Award. And so, Lisa, to you and your entire committee, well done. My only worry, Joanne, please, as this is moving forward to budget, please, I hope Lisa and the committee stay in place working towards next year, that it's not in a state of abeyance, if you will, Joanne, pending what the new council might do with budget. Mr. Chairman, through to Joanne for a comment, please.
Through you, Mr. Chair, no, we've made sure that the team stays intact, and between Paul and Vicky, they're covering the cost to get us through until the budget review next year, so we'll definitely not drop the ball.
Fantastic, Joanne. I'd be happy to move it at the appropriate time. Thanks, Mr. Chairman.
Now is the appropriate time.
I'll do it.
Moved by Jackson, seconded by Councillor Marula. All in favor?
Carried.
Any opposed? 8-3, the new 100% funded positions of BCASA. Moved by Councillor, who was that? Marula, seconded by Councillor Whitehead. Councillor Jackson moves it, seconded by Councillor Marula. All in favor?
Thank you.
That's carried. 8-4, the Hamilton Paramedic Service. Joanne, you wanted to speak to this item?
Through you, Mr. Chair, and just briefly, we haven't brought forward a report on the Code Zeros for quite some time, so this is a summary of some of the things that we're seeing in the community in terms of response time from the paramedics. We will be coming back likely as part of the 2015 budget in terms of some discussion about additional resources. Likely we will be doing that. But one thing I did want to point out, we were at a meeting on Friday with our partners at the hospitals and just reviewed their action plans, so both from the general, from St. Joe's and from the Jurabinsky. And I can tell you that they are really stepping up to the plate and aiming for much improved turnaround times in terms of the offload issue. So in the report, we do speak to some specific strategies with St. Joe's. I just didn't want you to think that Hamilton Health Sciences wasn't also stepping up to the plate and is contemplating some additional initiatives as well in terms of meeting the targets that we've agreed to with them. So we're moving forward, but I just don't want to leave council with the impression that all is well, because it's not in terms of the paramedic service, and likely we'll be back with a discussion next term in terms of some additional requirements.
Yes, and much appreciated. If we keep the dialogue going, we can start putting little dents as we're seeing. And Michael, you're doing a terrific job paying attention to this very important offloading file. I think Councillor Duval has a question.
Yeah, thanks, Mr. Chair. And through you to John. John, when I was going through the report, it seems we've been working hard on this for many years, and you know we keep throwing money at the situation, and I know our frontline workers are out there doing everything they can, but every time we have a plan, we're going forward and we're trying to work with the hospitals. It just seems some of the times are getting worse, and I'm not sure if that's because they're just taking for granted, oh, well, we'll get an extra nurse and this is what we're going to do, but there seems to be a disconnect here somehow of having these times get lower and lower.
Through Mr. Chair, I'll let Mike Sanderson, the paramedic chief, answer that.
Through Mr. Chair, thank you, and I appreciate the perspective on that in terms of the cost and the staffing and how we move forward on it. Code Zeros are a complex matter. It's about the availability of ambulances to respond in the community, and I outlined in the report there were primarily three contributors to that. The duration of the event, in other words, the duration of the calls that our paramedics are responding to, and that's actually increasing. It's up about 13%. It's the number of events that we respond to, and that's gone up about 18% since 2008. And of course, the number of ambulances we have available, and we very much appreciate the ambulance that was put forward by council and approved for this fiscal year. The challenge for us was the hospitals, and we've really made some very good inroads with them over the last quarter in particular. We're actually seeing some trending at the hospitals with the 90th percentile for offload and transfer of care times decreasing within our recording system by up to 30 minutes. So we're seeing some significant impact, some significant direction on that, and we're very pleased with it. That doesn't mitigate against the fact that we still have ongoing complexity of calls. We have ongoing issues in terms of the number of responses that we're doing and other things that drive up the time. And I think that's partially the nature of the environment that we're seeing, the number of elderly that we have in our community, the number of responses that we do. We do have a significant number of challenges as the call volumes go up. It's never a flat process for us in terms of unit responses.
Okay, thank you. And so my other question is, do we see a problem that's existed ever since LHINS has made the when LHINS went forward with the redistribution about the emergencies, where the people are going to be put? So for McMaster closing and with the general, I mean, is this committed or allowed us to improve on it, or is this making us go down or giving us complications?
Through you, Mr. Chair, and I did not live personally the experience of the realignment of the hospital structures. My experience and my knowledge in the background of it is it's not currently a problem. We are managing it. We've put the resources into place in terms of how we could manage that activity. The hospitals are moving through the patient in an appropriate manner as we're getting the throughput and offload delays managed. So I don't think that that's currently the primary issue for us to manage. It really is about the duration of the calls and about the volume of calls that we have with the available resources.
So do you feel, Chief, that just the one nurse is actually fixing this, or additional staff is needed? I mean, there is something wrong. When I know when I go up to John Street and I see the hospital, it looks like a paramedic garage with our police officers. And you know, I mean, it's mandatory they're there because of the system we have. So, is it the offloading nurse we don't have enough, or is it just the system itself?
Through you, Mr. Chair, the offloading nurse is of assistance, and we're hoping that the ministry will continue the funding for that this fiscal year. So we believe that is a part of the strategy to assist the hospital in the offload process. But again, if they can get the patients offloaded through the offload nurse and get the flow through the hospital, the paramedics being at the hospital is not going to continue to be as much of a challenge. What will still be a challenge is the volume of calls and the activities that we continue to do. So. In response directly, it is helpful that we have the offload nurse in place. We think that's a valuable part of it, and we need to assist them with that through the ministry's funding, but we are going to have to continue to allocate resources to it.
Okay, my last question, is it the offloading nurse, or do we feel that we don't have enough paramedics or vehicles to supply the city?
Through you, Mr. Chair, it's actually a combination. The offload nurse does need to be there, and we do need to have more paramedics across the city.
Anyone else? Right. So let's move 8.4. Moved by Councillor McCaddy, seconded by Councillor Jackson. All in favor? It is carried. 8.5. This is the Affordable Transit Pass Pilot Program extension. And Councillor McCaddy,
I'll second it.
you got to share with us how this all started, because I know you've been there from the beginning and working hard on this file.
Thanks, Mr. Chair. Certainly, moving myself, second by Councillor Marula, who has also worked on this extensively over the years. And I'll be brief because I know we've got an agenda we're trying to complete. But this has been a very important program. We're working with the Poverty Roundtable for about 8 years now as your City Council representative on that group. We identified this as a need early on. And you heard from Tom Cooper earlier on this afternoon. This remains absolutely critical, probably even more important than ever, that we carry this program on. And municipalities right across the country have looked to Hamilton for our leadership on this, and they've taken notes and set up similar programs in their municipalities. So this is to keep the program going. And staff are making some changes by incorporating the Presto Pass, which is a smart move. And will be coming back to us in the early part of the budget process, 2015, to talk more about this as we look at the uptake of the program with Presto Pass incorporated. And we'll have a chance to look at this and make another investment in the 2015 budget process. Thanks very much. Thanks a lot to staff for working on this. Erica, in particular, her work has been tremendous.
Councillor McCaddy and seconded by Councillor Marula. All in favor? Any opposed? Seeing none. 8.6.
Just want to thank Joanne Priel for the report and Volunteer Hamilton. This originally came together back in 2004, I believe, and since then there's been some growing pains. But this report is before us. We've received assurances that unlike years past, where 100% of those in need, particularly seniors and people in need of shoveling their sidewalks, were not receiving the service, this report resolves that particular issue with an additional cost that is very reasonable. And this is one of those issues that it's not a want, but a definite need, and the most vulnerable will be helped accordingly. And as a direct result, I proudly support it and move it.
Councillor Jackson.
So, Mr. Chairman, I concur with Councillor Marula. I want to recognize the chairman of the Volunteer Hamilton Board, Sam Chino, who's here today as well. And I met with him and Melanie, his executive director, a few months ago. And I've been probably one of the most vocal and critical of the program over the last 4 or 5 years. And only in my heartfelt way, Mr. Chairman, in terms of the number of unmatched seniors and those with severe disabilities that could not be matched for snow clearing. And I learned the executive director had taken upon herself on weekends 3 or 4 of my seniors, which I never would have expected, Sam, that Melanie would have done that. But again, just because to deliver the service when no student or volunteer was available, the executive director took on 3 or 4 locations in my ward, which I'm deeply, deeply grateful for, but would have never ever expected. So, look, this is a transition. I think it's a win-win-win, above all win for our community and our citizens that need this service. It's a win for Volunteer Hamilton in terms of it keeps them in the game and also provides some form of base funding for them as I understand they're going through some transition as well. And through Joanne's, General Manager Pearl's creativeness, the B part will allow maybe another 100 to 200 of unmatched before B match with the snow clearing. So with fingers crossed, Mr. Chairman, I support this, if for no other reason, getting us through another winter season with the experience that this program provides. Thanks, Mr. Chairman.
Councillor Whitehead.
Thank you, Mr. Chair. I certainly support what's before us. I know that I certainly got my exercise this winter and attended a number of seniors' homes and shoveled their sidewalks and their windrows. But there's only one, there's only so many of us can do that. But what I heard from a lot of seniors is, because it was an exceptional winter last year, and apparently they're going to call for another exceptional winter this winter, is that they were getting gouged. The ones that could afford service were getting gouged by contractors, $200 to one time clean their sidewalk and driveway and those kinds of things. And at their age, it gets a little difficult to determine who the bona fide, who's legitimate, who's the scammers. And the question was proposed to me whether the city would consider putting a list of those that are prepared to pay for the service. And if the critical mass is there, whether we would be prepared to go through a tender process, get the best value for those people that are prepared to pay for the service and have that service delivered, sanctioned through the City of Hamilton. So I'm just raising it as a concept now, but it's certainly something we can have further dialogue on. But clearly, last year there was a number of seniors that were gouged by contractors as a result of the demand. And I certainly don't want to see any seniors get gouged by these unscrupulous contractors. So we need to look at a way to at least address that, or look at a different program that gives them the security knowing that the contractor has been sanctioned and get reasonable priced delivery of service. So that's something to have a discussion on further.
Thank you, Councillor Whitehead. And Sam and Volunteer Hamilton, thank you for not just this program, but everything you offer our community. And I know we'll have a bright future working together, approving this here today. I got a great idea and agenda review that I shared with just a few of our senior staff, but the next time we meet up, it's to get more high school students involved. I'm not going to bore anybody with it now, but I know the next time we have a conversation, you might go, hey, Jay, you want to sit on our board? So let's chat about that, because I think more young people should step up, and no one could coordinate that conversation better than your group. So thank you. H6, moved by Councillor Marula, seconded by Councillor Jackson. All in favor? Any opposed? Seeing none. H7 is the investment in affordable housing, moved by Councillor McCaddy, seconded by Councillor Marula. All in favor? It is carried. 8.8 is the coordinated access system for social housing. It's moved by McCaddy, seconded by Councillor Whitehead. All in favor? Carried. Councillor Jackson, your motion on the Firefighters Drum and Bugle Corps.
Mr. Chairman, moved by myself, seconded by Ward 4 Councillor Sam Marula. It's there in front of you. Staff just didn't have time to put a report together given the tight time schedule with the election upon us. This is something traditionally has come through the Fire Chief's office in support of the Drum and Bugle Corps, the great history and connection they had for about 40, 50 years. And if you recall, this was part of the group in selling 175 Dartnell Road last week that committee unanimously endorsed. Thank you.
Who's seconding this? All in favor? Any opposed? Seeing none. A motion to amend the outstanding business list as outlined in item 11.1. Moved by Councillor Marula and seconded by Councillor McCaddy. All in favor? It is carried. I am going to turn very quickly to Joanne Priel right now, because she was nice enough to print up for me 3 pages of small print that is the list of our accomplishments this term. And we thought if we had time, and I know 2 had to leave about 20 minutes ago, and 1 stuck it out. I don't know what to do, because it's a long list.
Send that out as a press
So to Joanne?
Just 1 minute, if I could have your indulgence.
Please.
And I'll circulate the list, because I think it's something that we should be very proud of, and everything is not on there. I want you to know that I asked all of my team to come here this afternoon, And so they're here sitting with me because it's them that did all the heavy lifting. Jillian said to me during our committee as she watched the discussion that this has been the best committee. You've been extremely supportive. You've given us great advice. You've enabled us to move forward on a lot of great pieces of work. Each one of you, if I had the time, I would like to go around the table and acknowledge each one of you for particular issues that you've helped us move forward on, including today. I know that Erica's breathing a big sigh of relief behind me because she's worked really hard trying to find, it's not me, it's really, none of this is me. I mean, Erica worked really hard trying to find a solution. She was nervous, and I said to her, I guess right now wouldn't be a good time for me to go to the bathroom. And she said, no, please don't do that. But I absolutely have the best team. They work so hard on behalf of you and the citizens of Hamilton, but we really wanted to take this opportunity to thank you. You've enabled us to do a lot of great work. It's a partnership. None of us can do this on our own. It takes a great administration. It takes a great council, and I think we have been that. And so I want to thank you, and I hope to see you back for the next 4 years because we've got some heavy lifting to do. We'll be here to support you in whatever way we can, but really it was an opportunity for us to say thank you. So thank you.
So Joe will send this out to all the committee members. I'm going to copy and paste and put it on jasonfarr.com, so anybody who's watching now would like to take a look at it, they'll be able to do so there. And we could maybe send it out as a press release and get some advice on how to do that from Councillor Marula. Move to adjourn, Councillor Marula. Seconded by Councillor Jackson. All in favor? It's carried. Thank you. And thank you to all our talented staff. It's been fun being chair.
There you go.
Ready to get up.
I know. It's not me. Huge. Huh? What? The house. There's lots of, yeah. All good work. Okay. That was easy, wasn't it? It was very easy. So thank you. So, take care.
He was out of commission until the start of the month, right? When he gets back. Yeah, I know. I'm looking forward to going on some walks. It's a lot of fun.
He loves that.
Good. Well, keep at it. See you later.
Another one in October, too. Days there. And I'll tell you, I'm going to keep taking.
Oh, I know who she is. I mean, I'll write down her name, right? Yeah, they'll have her contact information. Yeah, she was right on the corner. Here?